Hi, I'm Michelle Tompkins, your wellness manager. I'm here joined with Sharon Krispinski, Lee Health's Chronic Health Program Coordinator. Sharon, thank you so much for being here.
Thank you for having me.
So tell us a little bit about the program. It's called Diabetes.
Yes, it's diabetes, evaluating the various treatment options.
That's right. Okay, so we know, most of us know out there that there are two different types of diabetes that we hear about. I believe type 1 and type 2. What are the differences between the two?
Yes. Well, there are actually two distinctly different diseases. Type 1 diabetes is an autoimmune disease where the patient's pancreas is not producing adequate amounts of insulin. Therefore, they must go on insulin injections from the day of diagnosis and stay on it for the rest of their lives. But type 2 diabetes, which is by far the more prevalent form of diabetes, is totally different. With type 2 diabetes, you may be producing plenty of insulin, but your body cells are resistant to that insulin. So we treat that differently than we would type 1 diabetes.
You mentioned the prevalence. What is the prevalence of type 2? What are the causes?
Yes. Well, the prevalence of type 2 diabetes is it affects 29.1 million Americans. But what's really frightening from that statistic is approximately 30% of that population is undiagnosed. The concern is with type 2 diabetes, very often you have no symptoms at all, or the symptoms are very mild in nature. So it doesn't prompt you to seek medical attention.
That's scary.
It really is.
What are some of the symptoms?
Well, the symptoms that someone might notice with diabetes is they may be drinking more, they may be urinating more, they may feel unusually tired, they may notice like slow healing sores or an increased tendency for infections such as urinary tract infections or for women, vaginal infections. You may have some blurred vision, but as I mentioned earlier, very often you have no symptoms at all until a complication occurs.
Well, it sounds to me like you're going to be focusing more on the type 2 side of diabetes. What are some treatments that we could take?
Yes, with type 2 diabetes, actually with both types, we talk about meal planning and we go over carbohydrate counting. That's how we do the meal plan. And really the meal plan for people with diabetes is really how we all should be eating, whether we have diabetes or not. So it's not a specific meal plan just for people with diabetes. But then we talk about physical activity and we talk about stress management and the various medications that we can manage to treat this condition as well.
So it sounds to me like lifestyle is a big component of diabetes or not having diabetes.
Absolutely. I think it's very important to understand that with type 2 diabetes, with osteoarthritis, or any other chronic health condition, we can prevent these conditions by adopting a healthier lifestyle. Meaning that if we need to lose weight, if we can lose even 5 to 10% of our body weight, we're going to significantly improve our blood sugar control and prevent other chronic health conditions. The importance of physical activity. I tell patients all the time, we have to stop thinking as a physical activity as an option. We have to incorporate that into our daily lives. Because if we can do these things, then we can prevent a lot of these health conditions.
I love what you just said. We have to stop thinking it as an option of physical activity, and it's something that we have to do. It's mandatory.
Yes,
almost required.
I do. I tell my patients you have to exercise just like we get up every morning and brush our teeth and make our beds. We have to allow at least 30 minutes of activity per day. We really want to shoot for at least 150 minutes per week.
Absolutely right. Exercise most days of the week.
Absolutely.
It sounds like you're a wealth of knowledge, and I don't want to give too much away because I want everyone to come and listen to you. But you mentioned so many Americans have type 2 diabetes. Why? What is causing us to have such a high incidence?
It's really, as you stated just a few minutes ago, it's our lifestyle. We are gaining weight. That's one of the major risk factors for type 2 diabetes. We also have a genetic predisposition for diabetes. And then as we gain weight, as we get older, we're more at risk. Our stress level can predispose us for type 2 diabetes as well. So there's some risk factors, such as our weight, that we can modify and change, but then there's others that we can't control. So we really focus on that importance of meal planning, exercise, weight loss for the treatment of type 2 diabetes. What we have to understand is we can prevent type 2 diabetes. So even if you have pre-diabetes, we can prevent that from going to type 2 diabetes through a healthier lifestyle.
Well, it sounds like it's going to be a great program for our residents who are interested. They may have a family member or a close loved one. They want to attend this to learn a little more and gain some
Absolutely.
more knowledge on the
Yes.
topic. Thank you so much for being here with us. Please call your service desk, sign up for diabetes program, various treatment modalities with Sharon here at the Grand Cypress Room, 2 p.m. Don't forget, it's February 23rd. Thank you so much. We'll see you there.